to you by Marcus and Mack, a law firm representing injured people. And we were just talking about you, Dr. Klain. Were your ears burning?
They were.
Well, I'm glad that we were able to get through to you. This is Men's Health Month. We had Dr. Maliver on earlier this week talking about prostate cancer and prostate health. But that's just one of the many different health topics you're concerned with when it comes to men's health, isn't it?
Yes, indeed.
Yeah, there's so many different things, and we were just talking about some of them. And I guess where I want to start our conversation in the few minutes we have is the idea of having a PCP and not just having one, but then scheduling the annual and taking care of your health in that way. That monitoring, that's a real first step that everybody needs to take, right?
Absolutely. And, whether it's a family practice doctor or an internal medicine doctor, I think the most important thing for every adult male is to have a relationship with a doctor that they can talk about primary care and talk about preventive medicine.
We hear statistics about the number of different interventions that can be made once you're able to diagnose something that avoids having to get into a much more complicated procedure because you waited too long. That's always been the case. We talk about it a lot with women's health and mammograms and those things, but there are certainly things that guys need to get checked up annually as well, aren't there?
Absolutely. The number one killer in the United States is still coronary artery disease, and closely followed by stroke and its complications. And by establishing a good relationship with a primary care doctor, he can determine your risks and decide how aggressively things need to be treated to try to prevent those things. Just to give you an example, I've been in practice in Indiana for more than 30 years. And when I first came here, we had maybe one or two functional 90-year-olds. And now, every day in my practice, I see two or three people who are in their 90s and still functional and active in the community. And 100% of that reason is because we so aggressively now treat high blood pressure, treat high cholesterol, and prevent some of the complications from stroke and heart attack that used to kill people regularly in their 50s and 60s.
And the treatments for things like high blood pressure, they have evolved down through the years as well, haven't they?
Absolutely. It used to be there was only a small number of blood pressure medications, and we had to resign ourselves to tell people that they would have all kinds of symptoms. But I tell people on a regular basis, our first step is always to try lifestyle. So try to lose weight, try to limit sodium, try to increase exercise. But if we still can't get blood pressure down, there's so many medications that almost always we can find a medication and treat the person without side effects. Most men are afraid of taking blood pressure medicine because they've heard it makes them tired. They've heard that they gain weight. They've heard that it can affect sexual function. But almost always we can find at least one medication that they can take without having those kind of side effects.
There are some barriers, and you just mentioned one. There are some barriers to guys actually going to see their doctor and getting that checkup. And one of those things is, you just said something about, blood pressure. Maybe somebody's thinking, if I go, he's going to make me stop doing the things. I won't be able to eat what I want to eat. I won't be able to use the salt shaker as much. It's just not going to be as fun.
Well, and, one of the big topics that I have with men as they approach middle age is that they can still lead a very vibrant, active lifestyle and be able to live within those healthy bounds. Most people find that once they start eating healthy, they feel better. Once they start controlling their diet and exercise, they have more energy and they're maybe able to do things. I can't tell you how many times in my practice that I've had people make just a simple change like stop drinking pop, and all of a sudden their diabetes is controlled. I've had men who are middle-aged who stop eating fast food, and all of a sudden they're able to lose 15 pounds with almost no effort and feel better and control their blood pressure. So again, I think what it really comes down to is finding somebody that you feel comfortable with and that you can talk to and work around those lumps and bumps in the road and make the changes that you can make to have a productive lifestyle. Because the thing that I tell people all the time, I'm not afraid of them dying. I'll go to a better place. But what I don't want them to lose is their independence. And a lot of times by just making very small changes in lifestyle, we can keep people strong and in their homes and driving and active.
Guys might have an idea if they haven't been to a PCP in a while, if they haven't had that annual checkup routine going, they might have an idea that it's a very, very involved process and very intrusive. What's a typical wellness checkup like?
Well, most people, when they come to the doctor, there's an intake by the nurses to check blood pressure and try to pin down medications and history, and then talking with the doctor for maybe 10 minutes in a person that's relatively healthy, and then the physical exam maybe takes 10 minutes. And I'm sure, most men are terrified that their physical exam has to involve a rectal exam, but that too has pretty much gone by the wayside. I'm sure, as Dr. Maliver outlined to you, not every man needs to have a rectal exam every year, even after the age of 50. We do prostate screening only in individuals that have symptoms or in people that are at high risk for prostate cancer. So the exam itself is relatively limited and minimally intrusive, and the amount of blood work that may be required, again, is very limited.
We're talking with Dr. Matthew Klain here during this Men's Health Month, and we only have a second left with you this morning. Dr. Klain, if somebody wants to learn more, somebody wants to establish you as their family care physician, for instance, or your practice, what do they need to do?
Well, we have offices in Blairsville and in Indiana. I have two practitioners, Dr. Nettleton and Dr. Heasley, that work with me. We have two extenders, a nurse practitioner and a physician assistant. We're taking new patients. We take all comers for all insurance, and we'd be more than happy to talk with folks. We do telemedicine if people are uncomfortable coming into the office, but we're able to see people, and we're usually able to get people into the office within a week or two.
Mm-hmm. And what number should they call?
If you call 724-459-9111, that will connect you with the Blairsville office, or 724-349-4411 for the Indiana office. And if they contact the Indiana hospital operator, that operator can give you those numbers as well. And we're always happy if people just have questions. If they call the office, we'll always return phone calls within 24 hours.
He is Dr. Matthew Klain. Hey, thanks for spending some time with us today. I appreciate it.
Thank you, Mr. Marino.
Have a great day.
Bye-bye.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. A little bit late.